So we wanted to bring a program that would be able to support our nurses so that they can continue to provide that care and compassion at the bedside. So virtual nursing is a forward-thinking solution that leverages technology to help meet the healthcare demands.
The ability to give the bedside nurse those 40 minutes back so then she can attend to other patients on the floor, be able to give them the attention that they need. We know that nursing is becoming more and more demanding, as far as documentation, as far as other responsibilities. And just to give a nurse kind of 30 minutes back, I think that's super valuable. I think we don't realize how much 30 minutes is worth to a nurse.
Hey everyone, welcome to the Nursing Insights podcast. My name is Stephanie and I'm a registered nurse practicing in the state of New Jersey. Getting right to it, the state of healthcare right now is tough, to say the least. Let's just say that the nursing shortage does not spark joy. We can sit in that and stew in it for a while, but we can't live in it forever. Things are changing. So join me as your host as I partner with the New Jersey Collaborating Center for Nursing to hear from nurses across the state about their experiences, trials, and triumphs in the nursing profession. Welcome to the Nursing Insights podcast. Thanks for joining us today as we talk about virtual nursing. I'm super excited about this particular topic because I can imagine the kind of impact that comes with having a virtual nurse program back from when I started as a med-surg nurse on a telemetry unit. Today, we have joining us from Inspira Medical Center Vineland, which is part of Inspira Health, Frank Crispin, Nursing Director, and Veronica Perez, Nurse Manager. Thank you both for joining us.
Thank you for having us.
Do you mind telling us a little bit about yourselves and your role, as well as what virtual nursing is?
Sure. I'm Frank Crispin, Director of Adult Patient Services at Inspira Medical Center Vineland and Inspira Medical Center Elmer. I began my journey at Inspira probably about 20 years ago when I was hired in our ICU step-down area by the then manager, but now the VP of Patient Care Services, Dr. Terry Spaltor. I've worked in several areas in the organization, step-down, ICU, ED, quality, informatics, and obviously most recently in a leadership role.
And I'm Veronica Perez. I'm the nurse manager of a 36-bed acute care telemetry unit. I've been with Inspira Health for 16 years. I started out at the bedside nurse on an acute care unit. After about 4 years, I transitioned to the role of a patient flow supervisor. It was a new role at that time. And then I transitioned to assistant nurse manager of an observation unit. And then I transitioned into my current role as a nurse manager, which I've been in for the past 8 years. As a leader, I've been involved in the opening of a new unit. I've been a part of many performance improvement projects, but I do have to say virtual nursing has been one of my favorite projects to work on. I was excited to see the impact that virtual nursing has on nursing, the nursing workforce. And just to touch base on what virtual nursing is, it's a form of healthcare delivery where nurses can provide support and education to the bedside nurse from a virtual standpoint, using different technologies that we can put in place to be able to tap into the patient's medical record, but also be able to tap into the patient's room to be able to see the patient virtually and be able to assist the bedside nurses from a virtual standpoint.
Thanks for sharing about that, Veronica. I think it makes a lot of sense to be able to have that extra support at the bedside is amazing, especially for, I would suppose, new nurses and for maybe staff units that require a little bit more support, perhaps at discharge times or other times. Would love to hear a little bit about your healthcare system and what got you into the thought of getting virtual nursing set up.
Inspira Health is really more than a healthcare system. It's a story of growth, excellence, and deep-rooted commitment to our community. Our mission is simple: to provide a safe and compassionate experience that improves the health and well-being of our community by placing the safety of our patients and support of our employees with all that we do. We live this mission every day through I Create: innovation, compassion, reliability, empathy, access, teamwork, and empowerment. Our frontline staff was actually very instrumental in creating those values for our organization. So that's something that we really stand by and committed to. So our journey began back in 1899 when we opened our first hospital in Bridgeton. And over the decades, we've grown to hospitals in Vineland, Elmer, Mullica Hill, along with the Health Center in Bridgeton and Woodbury. In 2023, we welcomed Manton Medical Center into our network. In 2024, we opened a brand new facility in Woodbury. And today, we're in the process of building a brand new 4-story tower at our Mullica Hill campus. Across the network, we offer a full spectrum of care from emergency services, maternal child health, cancer treatment, to behavioral health and bariatric surgery. Clinical research is an important part of our organization. We're proud to be a teaching organization as well. We have a resident program. We support the next generation of healthcare professionals We do have a lot of recognition where we're very proud of. So our Vineland, Elmer, and Bridgeton campuses have all been 4-time ANCC magnet designees, and that's ANCC is the American Nurse of Credentialing Center, for those that don't know. Milton Hill and Woodbury are 2-time ANC Pathway to Excellence designated and actively pursuing magnet designation. We serve a diverse population across Cumberland, Salem, and Gloucester County. We face both rural and urban health challenges. In our 2025 and 2027 Community Health Needs Assessment, we identified key barriers like cost of living, access to care, chronic illness, safe spaces for youth. We're tackling all that head on by our outreach program, community health implementation plan. In Spirit, we're really trying to build healthier communities, and we're excited about that journey, and we're excited to share some of that journey with you.
That's amazing.
So, and just to tag along to what Frank was saying, so our reason for instituting the virtual nursing program was, like many hospitals throughout the nation, we too were dealing with difficulties in hiring and retaining nurses. So if you read a lot of articles, there's a lot of research and a lot of professional articles that talk about the nursing shortage that we're going to experience. So the acuity of our patients and the nursing workloads are leading to nurse burnout throughout the nation. So we are an organization that prides ourselves on innovation and technology. So we wanted to utilize the virtual nurse program to help support our nursing workforce. We wanted to implement a virtual nursing program that aligned with our organization's strategic plan of enhancing patient-centered care while improving operational efficiency and supporting a resilient nursing workforce. We know the nursing workforce has faced many challenges over the last several years, and we want to be able to support our nurses in the work that they do at the bedside, because they're really the hands of nursing. They're the ones that are in there day in and day out, caring for our patients. They're the ones who are getting the brunt of the workload. It can be a lot for a nurse, but the care and the compassion that the nurses bring to the bedside is like no other. So we wanted to bring a program that would be able to support our nurses so that they can continue to provide that care and compassion at the bedside. So virtual nursing is a forward-thinking solution that leverages technology to help meet the healthcare demands.
I think Veronica's probably being a little modest because she's very instrumental in coming up with these innovative ideas and bringing these to the forefront. And I think one thing about Inspira is that we're very supportive of those ideas and bringing those to light. Like I said, we're very dedicated to research. We're very dedicated to moving the nursing profession forward. And I think Veronica's a perfect example of how we can do that. She's been very instrumental in bringing those innovative ideas to light.
Thank you, Frank.
Not to give her a shout here for this, but just to...
Thank you, Frank. But, I don't forget what it's like to be at the bedside and the workload that the nurses take on each day that they come to work. It's not just physical, it's also, emotional, because they, you do grow an attachment to your patients when you're in there caring for them for 12 hours. So as a leader, I want to make sure that I support my nursing team. So when we went to implement the virtual nursing program, I was excited to be able to continue to help the nurses at the bedside and support the work that they do day in and day out.
I love that. I love the support between the both of you, which is just absolutely phenomenal. We need wonderful leaders and we need innovators and people who are willing to step up and do the work, because you make it sound very simple. We just implemented a whole nursing program, but I am sure that was blood and sweat and tears and conversations upon conversations. So congratulations to you for being able to push that through. And thanks for your leadership, because I'm sure for all of the nurses who have been impacted by that work, it's been really monumental. Were you looking to expand to other units one at a time? Would it be, as you re-implement the virtual nursing program with your technology, you'll start off in other similar med-surg units, or were you going to go into any other kind of specialty areas, or still a thought in the future?
So I think our original intent was to mirror the program in our Monaco Hill campus. I think that was the original intent, where we were thinking of taking it system-wide, just starting in one unit, and then move to having it really work throughout the system, throughout the network. For our med-surg units, most because they are the biggest dischargers and emissions, right? So that was really the intention. But I think that thought is still out there. We're really looking into where we can put it. But I think the benefit really would benefit the whole network. Every unit would really benefit from virtual nursing.
So part of the pilot program with reviewing some of our metrics was we also noticed an increase in our patient experience scores, in our teamwork score, and our discharge information score. And that had a lot to do with, it did take a team to be able to implement the virtual nursing and make it successful, but also the amount of time that the virtual nurse had to really go over that discharge information with the patient during that discharge time. So we did see a favorable response with our patients when they filled out their surveys to let us know that the virtual nurse was something that did have a positive impact for them.
I think also the benefit was the fact that we're giving the actual bedside nurses that 35, 40 minutes back, right? Because it takes about 35, 40 minutes for you to do a full admission assessment, sometimes longer, depending on how complicated the patient is. And I think the ability to give the bedside nurse those 40 minutes back so then she can attend to other patients on the floor, be able to give them the attention that they need. We know that nursing is becoming more and more demanding, as far as documentation, as far as other responsibilities. And just to give a nurse kind of 30 minutes back, I think that's super valuable. I think we don't realize how much 30 minutes is worth to a nurse.
Especially with all the tasks that they have. And a lot of times our nurses, with the demands of the job, sometimes will go 12 hours without taking a second for themselves. And I think giving them those 30 minutes back in the day actually gives them that time to be able to say, you know what, I can sit down and actually take a break and eat my lunch without being interrupted and be able to take care of themselves. Because as nurses, we need to be able to take care of ourselves so that we can effectively be able to take care of our patients. So we stress that to our nurses, self-care first. We understand that you have all these things that you got to get completed in the day, but it does truly take a team to be able to care for our patients and be able to provide that high quality patient care. So we really need to lean on each other to be able to take care of ourselves and be able to be healthy ourselves as well so that we can be there for our patients.
Provide the great care that we want to provide, right? Because as nurses, that's just our instinctual kind of trait, right? That we are caregivers. That's what we do.
I'd love to hear a little bit more, Veronica and Frank, about what that mammoth kind of effort was. Even starting out with wanting to be able to implement the program, what were some of the conversations that allowed you to tell your leaders that, this is something that we could really see benefiting our staff? What were some of those kind of thoughts and points that you made even to help promote the idea of wanting to institute virtual nursing?
So we actually had created a team to help develop the workflow of the virtual nurse. And this included our bedside nurses, and it actually included some of our nursing leaders from the organization was part of the team when we went to develop the virtual nurse program. Our senior leaders, our administration was actually very supportive of the virtual nurse program. The leaders that were part of the team had actually attended a virtual nurse conference in Washington, D.C. during our time when we were preparing to implement the program. So it kind of opened our eyes to all of the technology and all of the different ways that virtual nursing can be utilized. So it made me very excited because I'm like, there's a lot that you can do with virtual nursing when you get the technology in the patient's room to be able to be successful in the program. And you got to hear from different organizations as to what they were doing with the virtual nursing. Some of them were doing the same thing that we were doing and utilizing iPads. Some of them were actually investing in the technology that can be placed in the patient's room and remain in the patient's room to be able to utilize for the virtual nursing. So with our team, we had some brainstorming sessions, and it was great that we included our bedside nurses because they were able to give us feedback on what was their vision of the virtual nursing. How can the virtual nurse assist them from a virtual perspective, because they wouldn't be at the bedside. It's something that we would have to use technology for. So after some discussion with the nurses and senior leaders, we decided to utilize our virtual nurse for admissions and discharges because it is kind of task oriented and it takes up a lot of their time throughout the day. So we had completed a pre and post survey when we did our program, just to kind of get an idea from our nurses. So pre-survey, some of the questions were, on average, how much time do you spend doing an admission? How much time do you spend doing the discharge? Just so that we can gather how much time we actually would be saving the bedside nurse by utilizing the virtual nurse to complete admissions and discharges. We also try to kind of get a basis of their understanding of the virtual nurse with some of the questions that was on there as well. So once we collected our data, we figured out what our program was going to be. We collaborated with our informatics team, and we decided to use iPads that we had available. It was some current technology that we had that wasn't being utilized. So we, with our informatics team, decided that we would utilize the iPads. So with the iPads, the way the workflow was that our unit clerk would set up the iPad in the patient's room for the admission or the discharge. So they would call the virtual nurse from the iPad and have everything set up in the room. There was scripting that we gave our unit clerks to utilize when they went into the patient's room for them to tell the patient that there was going to be a nurse that was going to come on virtually and go over their admission database or go over their discharge information. The virtual nurse was located, we have a command center, and in our command center, we have virtual sitters that are there. We have a bed coordinator and we have a transport supervisor that are located in a command center. So we thought that was an ideal place to put the virtual nurse. So the virtual nurse was in the command center, and the unit clerk would set up the iPad in the patient's room and let the patient know that the virtual nurse was going to come on there. And then the virtual nurse had access to the patient's medical record. So they would have the patient's medical record pulled up on one screen. At two screens. One was for the patient's medical record. The other one they used to do the virtual conference with the patient. And then they would go over all of their admission questions, complete all the information in the patient's medical record. The same thing with the discharge information. They would go over all of their discharge information. What was really great was that they were able to give that time back to the nurse at the bedside, because according to the surveys, the average time that it would take nurses to do admissions was like 30 to 45 minutes. Discharges, they average about 15 to 30 minutes. The other thing with the discharges is the virtual nurse had that dedicated time to be able to spend with that patient to thoroughly go over the discharge instructions to make sure that the patient understood all of their medications, they understood all of their follow-up, so that we wouldn't have those readmissions back because they missed an appointment or they didn't go pick up their medications. The virtual nurse would also call the pharmacy. We have an outpatient pharmacy where we have a meds to beds program. So our virtual nurse would actually make sure that those medications were being delivered to the bedside so that the patients were leaving with their medications upon discharge. So there was a lot that we utilize our virtual nurse for. In addition to doing admissions and discharges, we also have what we call progression of rounds, where we discuss every patient on the unit, kind of what's going on with their care. And our virtual nurse would be part of that so that they knew a little bit about what's going on with every patient on the unit. And if there was any follow-up from the progression of care rounds to progressing the patient's care, they would place those phone calls. So if we were waiting on an x-ray, if we were waiting on a lab, they would place those phone calls while they were waiting for these admissions and discharges to come through. So they were utilized during their time that they were here. Part of our virtual nurse program was that we did utilize our own nurses for this program. So a couple of our more senior nurses volunteered to do the virtual nurse. So they were alternate weeks. So 1 week they would work 2 to 3 days as a virtual nurse, and then the following and 1 to 2 days at the bedside is kind of how we did it, because we had 2 virtual nurses at the time, and we were only utilizing the virtual nurse at that time during our pilot program, Monday through Friday, 7A to 7P. So determined this time, we had a heat map that we assessed to see when would be the best time to utilize the virtual nurse during the pilot. And that's what we came up with, was the Monday through Friday, 7A to 7P. So the virtual nurse still had a couple of days that they were working at the bedside, but then there was a few days that they would work as a virtual nurse. They really enjoyed this because it kind of gave them a little bit of a break from the bedside, and it allowed them to work in a different role. And it also allowed them to be able to help their peers. And the nurses at the bedside were on their units were more receptive to the virtual nurse because it was one of their peers who was on the other end doing the admissions and discharges for them. Because in the beginning, you know how us nurses are. We want to have control of everything. So when it came to discharging the patient, well, I want to discharge my patient because I know my patient. So they wanted to make sure that they were going to be as thorough with completing the discharge as they would be. So knowing that it was one of their peers, they felt more comfortable with their peer completing the discharge or completing the admission for their patients. So there was a lot of work that went into it. There was a lot of, we continued to have meetings and obtain feedback from the staff to see how else we could strengthen our program throughout the entire time that we were running our pilot program.
That was amazing. What an amount of work that probably took, because you're talking about getting all of the technology, the informatics teams, the nurses on staff, the leaders. I mean, it sounds wonderful that you were able to get from the beginning. The leaders were in alignment with you all, that it would be a great program to have. And you said that it did sound like the bedside nurses were also interested in having that extra support. So from the beginning, it sounds like everybody was like, we just need to make this happen, but it's going to take some time. What made some of those conversations happen that allowed it to become one of their own staff members? Because it sounds like that's pretty pivotal in making sure it worked for the bedside nurses, that they could trust the other, on the other side of the screen to do the same work that they would do. How did that conversation come into play?
I think it's at the time we just wanted to pilot the program. We weren't exactly sure how this was, the outcomes or how this was going to flow. At the time when we implemented the program, virtual nursing was still fairly new. So we wanted to make sure that it was going to be something that was going to be beneficial to our organization. So we did decide to just utilize our own nurses and use the technology that we had on hand to be able to truly assess if this was going to be a program that was going to be beneficial and successful for the organization.
And I think like a lot of other organizations during that time, we're facing the same challenges, nursing shortages, high turnover rates. So I think actually having our own nurses from the unit itself really played into that and kind of help support that, right? Because we were able to kind of have the very nurses that were doing the same work, and they were able to have a good relationship with the already nurses that are on the unit, so they were already familiar with them. But it also served the purpose of, hey, we didn't have to kind of seek out other nurses from other places because we were already facing nursing shortages. So I think it kind of helped out in that way too.
That makes perfect sense. And you were sharing that the pilot program was something that you had from 7A to 7P, Monday through Friday. That's something that you were able to do based off of your heat map. Did you notice any outcomes in that pilot program, like between the different shifts, the shifts that did have the virtual nurses and the shifts that didn't? What kind of feedback did you get during your pilot program?
So I think another huge impact that the virtual nursing program had was the fact that at the beginning of the virtual nursing program, there was really a lack of understanding of what virtual nursing was and really what the impact of virtual nursing would have on their practice. And like Veronica stated, we did have a pre and post survey. So from the pre-survey, it was one of the questions was basically the understanding. I think that kind of stated, hey, what's your understanding of it? And the difference was really, really astonishing at the end.
Right. And the one of the questions that was on the survey that was really valuable was indicate your perception of the value of a virtual nurse can add to the care team. And our pre-survey, we were like at a 2 because they didn't have a really good understanding of the benefits of having a virtual nurse. But post-survey, we went to a 4 to 5. The 5 was the highest on the score that we placed on the survey. So you can see that the perception of the nursing staff did have a positive outlook once they were able to actually see the benefits of the virtual nurse. And in the beginning, we did start out small with our how many admissions and discharges the virtual nurse was completing. So the first month, they completed 13 admissions and 47 discharges because they were just kind of getting their feet wet with their program. We were still trying to work out all of the kinks. But they ended up averaging 140 discharges a month and 50 admissions a month. So if you take into account that it takes 30 to 45 minutes for an admission, 15 to 30 minutes for a discharge, you can see how much time we were giving back to the bedside nurse to be able to focus on their patients a little more.
And I think the reason that the heat map was used was, for the most part, to see when the bulk of our admissions and discharges were. So I'm sure, like many other institutions, we have minimal discharges on Saturdays and Sundays, for the case may be. And really midweek to late week, we have a bulk of our discharges. The beginning of the week, we have a bulk of our admissions. So really that's something that we were able to use technology again, to kind of figure out when those were happening and when would be most beneficial to have our staff working as virtual nursing. So I think that the impact for our other shifts was minimal because they really didn't see a bulk of those admissions and discharges. Like I said, the bulk of admission and discharges were obviously to the numbers, 140 discharges and 50 admissions by the middle to the end of the program. That was astronomical. I think that was a huge impact for time saving for our nurses.
Did you have any feedback from the patients themselves who were going through the process? Anybody have any preference for or against, or any interesting comments on the patient side, how the virtual nursing interaction went?
So I can say we did receive some positive feedback from the patients just because they were able to, when they got to the floor for the admission, the iPad was placed in the room as soon as the patient came in, so they felt like someone was attending to them as soon as they arrived to the unit. And then as far as discharge, it's the same thing. The virtual nurse was able to complete the patient's discharge a lot faster than the bedside nurse because, a lot of times they're tied up taking care of other tasks that are more urgent. So it could be a little bit of a delay before they get into the patient's room to complete that discharge. And when the patients hear the word discharge, they're ready to run out the door. So it was nice to be able to have the virtual nurse be able to be placed in the patient's room. When the discharge order went in, it was usually placed in the patient's room within 15 minutes because it does take time to complete the paperwork. But we did get positive feedback and, how quickly we were able to complete the admissions and discharges. And then just how thorough the virtual nurse was with the discharges, because there was times where they kind of reached some barriers to be able to actually discharge the patient safely. So they had to reach out to physicians to address those barriers. So it did help with being able to get the patients out a lot quicker when the discharge order came through. So we did get positive feedback. I wasn't sure how the patients were going to feel with having a nurse on an iPad. Some of it was like, this is different. But they, most of the comments that we received was positive feedback.
I think that was another great outcome that we had was the actual decrease in the discharge turnaround time. So one of our goals is to maintain discharge turnaround time to below 2 hours, or we want to get our patients to be able to go through that process. So through the virtual nursing program, I think it was about 20 minutes that we shaved off our discharge turnaround time, which obviously to a patient who wants to go home, 20 minutes is super valuable. So I think that was also one of the great things that we saw come out of this.
That increases the efficiency in everybody's workflow too, because 20
Absolutely.
minutes of patients out earlier, that means that bed can get cleaned. That means a new patient can come in.
Correct.
That means that everything can get done a little bit faster.
Absolutely.
So I think that's a phenomenal kind of like roadblock that was taken out of the way just by being able to speed things along a bit, which is wonderful. Did you actually have any commentary from the surrounding, from the support staff, from even the physicians, anybody else who had to interface with the virtual nursing discharge or admission?
So for the virtual nurse program, only the patients had contact with the virtual nurse at the time because they were just completing admissions and discharges at that time. The physicians didn't really get to experience the virtual nurse except for the virtual nurse, calling to try to clarify orders or, anything from the admission or the discharge that needed clarification.
But there was a lot of great collaboration between the floor nurse and the actual virtual nurse. So they would be in constant communication throughout the day about the patients. I think that was a great satisfier for them as well.
That sounds good. That sounds like a no news is good news, because if nobody is complaining, that means it's smooth. So that sounds like a positive thing. And it sounds like it's a big time saver for your floor nurses as well. Thinking about the future and what else it could look like, is there ideas of how you'd want to see a virtual nurse program kind of progress, or do you see that there's other opportunities to grow if you were able to expand the program at all?
So I think the future for Inspira is incredibly bright. After announcing the success of our virtual nursing program, we set our sights on bringing this innovation to the entire network. We dove into exploring cutting-edge technologies to help drive the program's growth. Although there was a brief pause, we built a groundbreaking operational intelligence center and made a major leap forward by implementing our Epic as an electronic medical record system. So I think our journey is far from over. Our hope is that we will be supercharging the virtual nursing program, centralizing operation and harnessing advanced technologies to take the patient's care to the thrilling new heights with virtual nursing.
I'd love to hear a little bit more about the scope of the pilot itself, how many units you were using, how many staff members were involved. You said there was 2 active virtual nurses at a time. Could you tell us a little bit about how many units the virtual nurses were covering and for how long the pilot program was going on for?
We implemented the virtual nurse pilot program on a 36-bed med-surg telemetry unit. We utilized the virtual nurse for 1 unit. We utilized 2 staff members from that unit. We did later on, in the middle of the pilot, we did add another nurse from the unit as a 3rd virtual nurse, just because we realized we needed someone to help cover some PTOs, because nurses do deserve to have some time off. So we needed to make sure that we had some coverage so that we can continue to have that coverage from Monday through Friday. We ran the pilot program for a year. Towards the end of the year, we were looking at expanding to other units at that time, but then that's when we realized that we should probably take a pause and reevaluate the technology that we have in place to be able to have a stronger virtual nurse program in the future.
That makes perfect sense. You're going to want to adapt it and change it and personalize it to the specific unit you're looking to implement on. After hearing about some of the interactions that your nurses and the patients had through the iPad, were there any interesting interactions when they would finally meet in person? Because you said these were staff nurses, clinical nurses who were functioning both at the bedside and across the iPad.
Right. So we did have, our nurses would do admission databases for patients virtually, and then there were times where they would come to the bedside and actually have to take care of those patients. So one, it helped the nurse already be familiar with the patient because they completed that patient's admission database, so they knew everything that was going on with the patient. But then the patient was also surprised to see them at the bedside. Like, they're a real person who actually was on an iPad a day ago and now is here at the bedside taking care of me. So they were a little surprised to see them.
It also shows that the continuity of care, it continues just as if they were face-to-face. You still have your same patients, you still have your same nurses, and the connection is still there. The rapport is still there, that they're able to make that connection continue as they continue care throughout the rest of the week or their stay.
Right. It did help a lot with that as well.
Veronica and Frank, what is it that you do at the end of the day to take care of yourself, to fill your cup? Because as we both have just shared and as we know, nursing is a demanding profession. What is it that you guys do?
So I have 2 children. I love being with my kids. So just coming home to my family is one thing. and I don't know if I can throw this out there, but I mean, prayer. Prayer is something that really helps me get through my day.
Like Veronica, I do have children as well, so I coach my son's travel basketball team. So that's really where I spend most of my time outside of here, practices and coaching and losing my voice. So that's pretty much that's my getaway. That's my happy place.
Frank and Veronica, thank you so much for joining us today on the podcast. It's been a real pleasure and such an amazing, experience to be able to hear about what virtual nursing can do for nurses everywhere. We are so grateful for your time, and thank you so much. Hope to see you again soon.
Thank you so much for having us. Appreciate it.
Thanks for listening, everyone. We'll see you next time on the Nursing Insights podcast.